Welcome to Navigate Newborn Screening, an educational program designed to help train and educate families about newborn screening. We're excited that you're interested in learning more about the newborn screening process and system. Before we begin, let's review some of the questions we will answer in this video. What are the different parts of the newborn screening system? What are newborn screening activities at the federal level? What is the Recommended Uniform Screening Panel, also known as RUSP? Newborn screening is more than just a series of tests. It's an entire system, and there are 6 main important parts to this system. The first part is the screening itself. This includes the point-of-care hearing and heart screening, as well as collection of the baby's blood sample. This is the heel stick, or blood test. After the blood sample is collected, the sample is sent to the state's laboratory for analysis. The second part is follow-up. During follow-up, your state newborn screening program will receive the screening results. If these are out of range, your state newborn screening program or your baby's healthcare provider will be in touch with you about these results. Some states require a second screen when your baby is 2 weeks old. If your baby received abnormal results, confirmatory or diagnostic testing may be needed. For babies that have an out-of-range newborn screen, the third important part is diagnosis. During the diagnosis stage, there may be a medical evaluation and additional testing to help your baby's healthcare provider confirm the abnormal screening result. If the abnormal result is confirmed, your baby has the condition. This may require a subspecialist assessment. A subspecialist is a person who specializes in a particular field of study or occupation. In this case, it may be a person who specializes in a particular medical condition. Counseling, such as genetic counseling, may also be recommended. The fourth part is management. This activity includes treatment and long-term follow-up for babies diagnosed with a newborn screening condition. That treatment and long-term follow-up will be different based on the condition and the state in which the baby resides. Another part of management is storage of dried blood spots. Storage of dried blood spots is important for both quality assurance efforts and in the event that a baby requires repeat testing. These blood spots may also be available to parents if their baby needs further health-related tests. You may contact your state newborn screening program to learn more about their process for storing dried blood spots. The fifth part is evaluation. This includes reviewing the previous activities, screening, follow-up, diagnosis, and management, to identify opportunities for improvement and to help determine the benefits of screening for both the family and the public. Finally, the last part is education and training. Education and training are key to making sure that the entire system works. This includes educating parents, the public, healthcare professionals, legislators, newborn screening personnel, including lab and follow-up, and other stakeholders about the newborn screening process. Now that we've reviewed the different parts of the system, who is actually a part of the system? There are many different roles and people who are responsible for maintaining and improving newborn screening, including state newborn screening laboratory and program staff, federal agencies, couriers, midwives, nurses, pediatricians, researchers, obstetricians, specialists, genetic counselors, nonprofit staff, educators, advocates, families, and you. We will talk more about how you can get involved in newborn screening a little bit later. Now let's review newborn screening at the federal level. There are 3 main federal agencies involved in newborn screening: the Health Resources and Services Administration, also known as HRSA, the Centers for Disease Control and Prevention, also known as the CDC, and the National Institutes of Health, also known as the NIH. Let's first talk about the CDC and the NIH. The CDC is a federal agency under the Department of Health and Human Services. The CDC has 2 major programs centered around newborn screening. The first program is the Newborn Screening Quality Assurance Program. This program helps enhance and maintain the quality and accuracy of newborn screening results and helps support newborn screening state laboratories. The second program is under CDC's National Center on Birth Defects and Developmental Disabilities, and it helps support critical congenital heart disease and hearing screening, follow-up, and cost analysis. The NIH is another federal agency under the Department of Health and Human Services and is responsible for biomedical and public health research. Its primary program around newborn screening is the Hunter Kelly Research Program. Under this program, the NIH helps identify, develop, and test the most promising new screening technologies. This program also helps develop experimental treatments and disease management strategies for conditions that can be detected through newborn screening, but treatment is not yet available. Now we will be focusing on the activities of the Genetic Services Branch, Division of Services for Children with Special Health Needs at the Health Resources and Services Administration, also known as HRSA. HRSA is an agency of the Department of Health and Human Services and is responsible for several newborn screening activities. The agency helps to establish grants that improve the newborn screening system. These grants focus on supporting state newborn screening programs, increasing awareness and providing education around newborn screening, and increasing access and coordination of services. HRSA also develops condition-specific programs. Examples include programs around sickle cell disease and hemophilia. And finally, HRSA supports the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children, which we will discuss in further detail next. In 2000, Congress enacted Title 26 of the Children's Health Act, which supported the creation of an advisory committee on heritable disorders in newborns and children. This committee is run by HRSA. But what does this committee do? Well, the advisory committee has a very important role. The advisory committee provides the Department of Health and Human Services advice and recommendations about grants and projects related to newborn screening, technical information to help develop policies that help support state and local health agencies provide screening, counseling, and healthcare services. And finally, the advisory committee provides recommendations, advice, or information as necessary to expand or improve the ability of the Secretary to reduce or improve morbidity and mortality of heritable disorders. The committee is made up of voting members appointed by the Health and Human Services Secretary. The committee may invite organizations to serve as organizational representatives. Eligible organizations must represent national public health organizations, medical professional societies, or consumer and family advocacy organizations. Each advisory meeting is open to the public. Part of the advisory committee's work is to review conditions for inclusion on the Recommended Uniform Screening Panel, or RUSP. The RUSP includes a list of conditions that are recommended to be included on states' newborn screening panels. The advisory committee reviews nominations for new conditions and makes recommendations to the Secretary of Health and Human Services for additional conditions to be added to the RUSP. For the most current list of core and secondary conditions, please visit the website on your screen. It's important to remember that the RUSP is not a law, but most states screen for the majority of the core conditions on the recommended panel. So if the RUSP is not a law, then who decides what conditions are screened for in each state? Newborn screening is a state public health program. Policies for who decides which conditions are screened for can vary depending on the state. It could be the state health department, a board of health, or the state legislature. We will discuss more of your state's role in additional videos. Now that you have a little bit more background on the RUSP, it's important to understand the criteria conditions must meet in order to be added to the newborn screening panels. The condition must result in serious medical complications and/or death if not recognized and treated early. This also means that the health outcomes of that condition are well understood. There must be reliable screening tests that exist for that condition. That screening test must have a low false negative rate. This means that there is a low proportion of screens where the results come back negative or normal when they are actually positive or abnormal. The screening test must also be simple, inexpensive, and allow for a quick analysis so results may be available on a timely basis. Additional criteria include an early effective treatment is available for the condition as well as a diagnostic test. And finally, the benefits of screening for the condition must outweigh the harms. Now that you have a better understanding of the criteria needed for a condition to be added to newborn screening panels, how are conditions added to the RUSP? Having a condition added to the RUSP involves a multi-step process. First, an individual or group may submit a nomination package to the advisory committee. This nomination package is then reviewed by the committee, and the committee votes on whether or not to send a nomination to full evidence review. If a nomination is recommended for evidence review, an external group then conducts a review of the evidence. The committee must decide, is there enough evidence to support screening for that particular condition? Committee members may look at existing pilot studies for that condition as well as existing research or literature on that condition and the condition's treatment. The committee then votes on whether or not to recommend that condition to be added to the RUSP. That recommendation is reviewed by the Secretary of Health and Human Services, who is ultimately responsible for approving or not approving the condition for inclusion of the RUSP. If a recommendation is not approved, or if a condition is not recommended to move forward for an evidence review or be added to the RUSP, conditions may be nominated again in the future. If you're interested in learning more about this process, please visit the website on your screen. So what is the difference between core and secondary conditions? Core conditions are conditions that newborn screening methods are specifically designed to identify. Secondary conditions are conditions that may be identified during screening for core conditions but are not the target of the screen. A full list of these conditions are available on HRSA's website. Thank you for watching this educational video. We hope that you feel more familiar with the different parts of the newborn screening system. Check out the next video to learn more about newborn screening at the state level.